health service. So the health service will be one. It's like a commission. And then all the various teaching hospitals, regional hospitals, and all these things, that's the tertiary level, the secondary level, the primary level, and then the basic level at the community level should all be managed and governed by the health service, one health service. And in my own opinion, we then run the hospitals as semi-autonomous institutions with a governing board. So Korle Bu will have its governing board, Komfo will have its governing board, the Sewia Regional Hospital, which is coming up, will have its governing board, the regional hospitals in the various places will have its governing board. So that all these hospitals, if you put the state-of-the-art systems there, then they can also be an institutions for teaching. I will not call it a teaching hospital. I call it a hospital that can teach. That also improves the level and the quality of our clinical training for nurses, for pharmacists, for all medical students, for all healthcare professionals. So that KNUST can send its students, either in the medical school or in the allied health schools, to any of these hospitals and accredit or designate anybody, to me, anybody who is a specialist, or for that matter, senior specialist or consultant, is supposed to teach. Can teach a medical student, isn't it? Can teach a pharmacy student, can also guide a nursing student. So once you do that, we can then take the intake can even increase, because one of the things which limits the intake of our health professionals is the clinical training. Because health professionals training is both didactic and also skills acquisition. So if you see about 20 nurses or 5 nurses following one patient for X-ray, it's not learning anything. So that it will be very few people who are in the wards in Korle Bu, Komfo Anokye, and the big hospitals. The rest are doing their rotations also in designated hospitals. If you go to Germany, that's a system that they run. They call it Kreis. No, they call it Lehrkrankenhaus. Lehr means teaching. So, and then the teaching hospitals like we have in Korle Bu and Komfo Anokye are called university hospitals. Mm-hmm. That's how it is. So that everybody will get a place to train. For example, now that we are putting psychiatric units, hospitals in Tamale and also in Mori, anybody who is doing rotation in psychiatry can go there and then learn. Even though we have psychiatric beds in Komfo Anokye, every hospital is supposed to have a psychiatric wing for mental patients, for acute mental patients. But those who need specialized care should be sent to these areas. And the students, health professionals can go there for proper training, and they will have rehabilitation. So this is how our healthcare system is. And I now notice that Ghana Health Service is now doing what they call network of practice, which means that they are now integrating all the healthcare system, both private and public, together. That's the reason why I believe that if you have one health service, where both the private and the public are all part of it, then you can have a seamless health services. And that one will even strengthen primary healthcare activities. So what the network of practice is doing is that you see, I should have put maybe allow you to put so that people will see. They've done it in such a way that there's a network of practice where the practice, there's a group practice for both private and public health services delivery. And they are all interconnected through administrative and clinical management model. So that the private facilities like hospitals, clinics, laboratories, diagnosis centers, community pharmacy are all embraced within this party. And then even National Health Ambulance is also embracing it. And then they have maternity homes. They have even marketplace in family so that people can go there and do simple checks and even do child welfare clinics there and give immunization. So we are taking the health system to the people, even at marketplaces, at lorry parks, so that a woman who cannot leave the thing that is selling and go for weighing or go and do immunization can access this immunization even at where he is. And now that we have digital system, we can also use digital health in addition. So as a makeshift, they can go there, do their weighing, and we believe that now in Ghana, everybody should have at least one health or the medical check in a year. I call it adult weighing. That is my decision. So that, like children, when a child is sick or not sick, he goes to see go to antenatal, postnatal clinic. The same thing, adult, the week or the month or the day of your birth, before you go and chill in the evening, you go and check yourself. When you're a woman, check your breast, check your cervix, check all other things. And according to how old you are, like those of us with white beard, you check your prostate every year. So that you then diagnose your system early, get to know it, and then be advised. For example, we will then get to know all the hypertensives, those who are developing hypertension, those who are diabetics, so that they start management after the early detection, and then they don't end up having a chronic renal failure before they go and look for dialysis, and it becomes a problem for the whole country. So these are some of the things that I think we should do. And to me, I've seen the network of practice, and I think that's the way to go, so that there's telemedicine also in addition, and the telemedicine can be used to support the lower levels, so that you can sit in Ofanochi or sit in anywhere and give other public health advice to somebody at the lower level, or he shows you whatever he's doing, and they say, oh, this patient, take the next available ambulance. And now that we have ambulance in all the constituencies which we are bringing more, so the ambulance service will also be very useful, the pre-hospital care, the patient transport, and everything will be done. But more important, we also then strengthen our public health systems in health prevention, health promotion, health education, and community involvement, so that those institutions which are at the community level are taken very good care of by the community. And I believe that even setting up the boards that I'm talking about for our district hospitals and the regional hospitals, we should even use the people who are in the community, who have the knowledge, so that they will then take the hospital as their property. That's what they do in the National Health Service system in the UK. They take people within the community because it belongs to them. But I don't believe, and I don't subscribe to a system where somebody in Tamale Teaching Hospital, a board member, is always in Accra, coming from Accra. He doesn't use that hospital for anything. He doesn't use that health system for anything. And then every health facility should have a governing board. And then when you do that, there will be accountability. And there will be people who know that they are accountable to somebody, not somebody in Accra, but somebody within the community. And that is how I believe that our primary health system can be strengthened, in addition to our national health insurance, making sure that health insurance takes care of at least the basic primary health care systems, like antenatal, maternity cases, postnatal, child disease, and then some of, I believe that also children malignancy and other things like sickle cell disease should all be taken care of by the health insurance. And then we also make sure that people also, especially workplaces, also maybe set up some reinsurance system, strengthen the private health insurance so that they also become part and parcel of the health insurance system. And then they can take care of things that maybe health insurance doesn't cover. So if you do all these things, then we can then have a very quality universal health coverage by the year 2030. I always qualify it as quality, because we can give universal health coverage to anybody, but if it's not quality, if the patients have to struggle before they get it, it's not universal. So both financial accessibility and then also geographical accessibility, and also people should also take their health as their responsibility, not only the responsibility of the carer, so that we know that even though I'm strong, walking around, at least once a year, you have to go and check your health status. And that one can be demanded by every employer before even promotion. And those who are going to school, every year before you enter school, you have to show the clean slate that everything is well with you. If it's not well with you, then the teachers will know that this primary school or JHS or SHS has maybe a problem, and that we have to open our eyes on the person and then make sure that he doesn't become fall sick and they say, oh, we have lost a child or student in the school. So that is what I believe, that if you want a proper health care system in the country, that's how it should be like. In addition to also things that we use to give the healthcare, like our consumables. Most of the both drugs and non-drugs consumables are imported into the country. So we cannot continue like that. It means anytime there's any change in our foreign exchange system, and that's one of the drains on our foreign exchange. Why can't you manufacture things that we have to use ourselves? That's the reason why, if you remember, as one of the post-COVID initiatives, we are also trying to set up a vaccine manufacturing and also other biological and serum manufacturing system in the country. And we believe that it's not supposed to be done by the private sector, by the public sector. Government should give the enabling environment for the public sector to initiate this, and that's exactly what we are doing. And we can only do that by strengthening and making our already matured Food and Drugs Authority become robust and become the best Food and Drugs Authority in the country, so that anything that is released, it will also be acceptable by the WHO and be pre-qualified. By doing so, we attract more foreign exchange into the country. And then Ghana, by training our health professionals very well, private sector coming into the system to support what government is doing in infrastructure and everything, we can then have in our big hospitals also centers of excellence where we can attract people from the sub-region into the country, because there's a huge market for medical tourism within the sub-region, nearly about $1.2 billion, which goes to Turkey and other places. Why can't we, as Ghana, become the gateway for these things? And we can do that one through the private sector, working closely together with the public sector. Because I've always said that health is wealth. There's also wealth in health. You can use health to create wealth, as well as if you're not healthy, you are not a wealthy nation. So we should not take health as a cost. We should always look at health as an investment. And once you do that, you can then make sure that your citizens are well, they have the welfare, and that they are healthy to produce more for the system to move on. So I'll end here, and then maybe if you have any further questions, you can ask.
Yes, thank you very much, Dr. Anthony Nsiah-Sarri. So far, I guess everyone is getting the whole detail about Ghana's primary health care. Indeed, it says that primary health care is the heart of every health system. And from what you are saying, it says that it shows that Ghana is indeed making primary health care its heart, the heart of its health system. But Dr. Nsiah-Sarri, I would like to find out that amidst all these plans government has, the education, health, everyone has put down and made plans for achieving universal healthcare coverage. I'm sure there are certain hindrances, there's lots of challenges which are not helping us to meet these. From where you sit, what are some of these challenges? I'm sure we would have time for questions, and people can also bring out the challenges they face with this primary healthcare system and getting to achieve universal healthcare coverage. So we would like to hear your stance on that.
See, the main challenge is that health is expensive. It's not cheap. So one of the biggest challenges, if you add all together and summarize it, is funds. That's why I said that we can mitigate that challenge by bringing private sector also on board, not only government. For example, I'm sure one of the biggest challenges that everybody will talk about is the health personnel. Like as you know now, there's a brain drain. I mean, people are leaving the country. You cannot, and I always say, people quote me, but I don't have any problems with it. You see, we are in a free economy. The whole world, anybody can move to anywhere. So somebody who is not under any bond, if he's leaving the country, you cannot stop the person. But we have to put in a lot of things to make the person stay. So these are the pull factors. So if the pull factors are more than the push factors, And everybody wants to stay in his country. See, because if you are in your country, you are like a king. Yeah, you go and do whatever you want to do outside. People will look at you as a foreigner. That's how it is. So things that hinder us from giving very good health services is funds, it's finances. Because healthcare, as I said, is very expensive. Even the infrastructure has to be continuously be maintained. You have to get the consumables that you need, and the personnel who is doing the work has to also to be motivated. You cannot take them out and motivate them above anybody. If you look, recently we had a meeting where they are doing the health, human resources for health strategy. And it's, when I read the document and I realized that 99% of all the health professionals in this country are employed by government, by the public sector. Private sector employs only 1%. So we are training a lot of people because now a lot of people qualify, even in medical school and nursing training school, because we have increased the number of people who are completing the free SHS. That's about millions, about 1.2 million or so of them. So every year, there are a number of people who come out. If you get aggregates in all the subjects, you qualify for university. So the person wants to enter university, but there are no facilities for the person to be in the university. Maybe the university could have doubled the intake, but the personnel, the professors and the lecturers to teach are not there. Also, the equipment and also the laboratories are all hindered. So these are some of the things. And more importantly, in health, we need mannequins, you need laboratories and all sorts of things. So first and foremost, the hindering factor is funds. Second hindering factor also, that's for training and also making sure that the personnel who are giving the health care are also, at least, they are motivated to stay. The only thing I can say that which motivates people, for example, to have an equitable distribution of a few professional healthcare workers is accommodation at the site where they are going. Because we have realized most of the hospitals that we are putting up under Agenda 111, most of them in the rural communities, rural districts, if you don't put any accommodation there for the person to be good, it goes there, they have accommodation which is furnished to stay in. It's a problem. And other amenities. All the cities are not the same. So we have to make sure that we make something very useful and very attractive for them. That's why I believe private sector should come in, put up what I call medical villages with an amusement center, with a commercial area, even a school. So that the teachers, if you put up the block of flats, teachers should also be part of the place where health workers are. So that if I'm a young person there, I have my children, I know where my children are going to school, within the 4 walls of the hospital. I know the teachers who are teaching them. The most important thing is during the early stages of your child education. Once the child goes to senior high school, we all went to senior high school, we left home, and then they go to university, they leave home. So I believe strongly that private sector should be attracted to put up such type of accommodations with all the amusement. And the example I use is the appeal court judges accommodation near the regional office, with swimming pool, with an amusement center. Maybe once in a while you bring even Shatawale and Sarkodie and the rest to come and play music for them at wherever they are. And these places are the places where government should give what we call the rural incentives, because he moves into accommodation, there's a percentage of salary attached so that he doesn't pay anything, even for the children's education. So by the time we realize that health worker has done his postgraduate and all sorts of things, and he has stayed there because he will wait till the child goes to senior high school. And then they spend over 15 years there. That is how we develop villages and we develop towns. Because I've seen it in Germany before. You see the hospital sitting in the middle of nowhere. Everybody living within that village where I trained. About 90% were working in the hospital, have something to do with the hospital. So that is one. So funding, both for consumables, also we are all producing our own consumables like catheters and all sorts of things. We are producing our own generic drugs so that the drugs are not expensive for any health insurance system to not to be able to pay. The second one is that when there are funds, then you can also make funds and give other incentives to the people. That's the reason why I believe that all the centers of excellence that you are putting up, you should use them also as a medical tourist center, so that if you are working within the hospital, you can also work at that tourist center, and then part of the income which comes in can also be shared or given as allowances for those who are working there. It will make people stay wherever they are, to make people stay in the country. The third one is that we should also continuously be funding also the professional education, all the schools that we are having. And then if you have a lot of people to train, there are a lot of senior high school people who are finishing. Why can't you also train for export? It's also possible, so that we are a range of countries who, after COVID, are not going to have professional training. Ghana can also be a center where we can train for them. The third one is also continuous professional development, and then the quality of the training that we are giving to people. And more importantly, also strengthen our health insurance system, so that you don't say that this one it doesn't cover, and the patient has to do co-payment. And then the next hindrance is if we put the health system in place, you put the primary health care system, you have to go and immunize your child and he's not going. And so the uptake of the health that we have put in place is very, very important. And that one is more, if people are well educated, they also take their health serious. Less educated, we have to also continuously be explaining things to them. So education is also very important. Another aspect of it is that, there's what we call the One Health system. The human, the animal, and the environment. If you continuously be destroying our environment so that you make 5-star hotels for mosquitoes to live in, then the mosquito elimination program will not be successful. If you are polluting all our water bodies with mercury and the rest, with galamsey and the rest, if we don't have a change of mind and then become conscious of our environment, we have a problem. We are now living with animals and everything. So we have to also make sure that our animals are well also catered for, so that now where we are in this world, pandemics will come and go. So we should be able to make sure that our surveillance system and then our disease control system are also in place. Sanitation, very important. Remember that since 2017, because of the improvement in our water and sanitation and toilet facilities, we have not seen any outbreak of cholera now in this country. It doesn't mean that we cannot see it. If you leave ourselves and then continue to pollute the environment, one day we wake up and there will be a serious outbreak of all these diseases in the country. So these are some of the factors which are hindering. Human beings also have a problem. So it's the way that we are dissipating our environment, and then also the way that we are also uptaking our health system are all very important. And these are some of the hindrances that we have to take care of. But more importantly is the funding. That's why I say that we should look at health as an investment, not as a cost. If you look at health as a cost, you always wait till, if you put in money, is it bringing any money? That's not the case. Health is wealth, and you can also create wealth from health.
Thank you very much. Yes, I know anyone who knows about the Africa Higher Education Health Collaborative, listening to Dr. Nsiah-Tariah puts it more in a light, and it shows all that we are doing is projecting our efforts to achieving universal healthcare coverage as a country. I love the fact that he mentioned that training is one of the gaps, and that is what this project also seeks to do. It is building capacity of primary healthcare workers across the length and breadth of this country and even beyond the shores of Ghana. And also, he said we should be producing our own medical staff, things to also generate income for our various facilities and hospitals. And that project, the health entrepreneurship bit that the Africa Higher Education Health Collaborative is projecting, and also looking at the health personnel themselves. The health ecosystem looks at this, And so today, listening to Dr. Nsiah-Ansari has really thrown more light into all these activities, and anyone who has been a part would tell the testimony of how this is making an impact. So Dr. Nsiah-Ansari, we also want to tell you that the Africa Higher Education Health Collaborative is indeed advancing healthcare in Africa through all these things you have mentioned. And so we know that all the efforts government is putting in place, there are also complementary projects which are also helping you to achieve. And as stakeholders, we believe that is what the government also expects of us. Thank you very much. We would like to give a few people the chance to ask questions. Once they have the presidential advisor on health, I'm sure they have a few questions, especially the primary healthcare workers on board. So I would see there's a hand already up. I would unmute you, Emmanuel Usu-Tabri. Dr. Nsiah-Ansari is online and would hear your question. Okay. Ima, are you able to speak? Otherwise, please type it in the chat.
Hello, please, can you hear me?
Yes, please.
Thank you very much, Dr. Anthony, and then Africa Higher Education Program that has been organized in K University. Thank you very much, Mastercard. I would like to ask a question concerning the funding. From a program that was sponsored by Mastercard, we were told and we learned that the main source of funding for the health sector in Ghana is through the government, and the government gets that money through the taxes. But now, from what we learned, I realized that the taxes that we are paying to the government that is used for sponsoring these primary healthcare services is low, and there is some form of invading and then invention of taxes. And also the insurance system in Ghana that helps to fund these primary healthcare services are not actually active. Most of the things done in the hospital are out of pocket payments. That is also having a negative impact on the people. They are not able to access because of money, and those that comes also don't have money to even do the services they have to do. Others are not coming at all. Are we doing something in the government sector such that we can mobilize more funds to fund these healthcare systems? Or what are we doing? Since we are mostly funded by the government, is government doing something to mobilize funds from the people so that these people in the country or the primary healthcare services can be improved? I just want to know.
Okay, thank you.
Want me to answer it now?
Yes, please.
Yes, it's true. I mean, most of the activities for primary healthcare activities is from government, from the public sector, is from taxes. And as you are aware, yes, there's a lot of things which are being put in place of our digitization. Once you digitize the system, people not paying taxes, now everybody has from Ghana card, everybody has a TIN number. So very soon, anything that you are doing, you have to produce your TIN number. Some countries do it. That at the end, remember that if you know anybody who is in the US, around March, before 31st March, everybody is running to go and file the taxes. Ghana, we don't do it. I know in Nigeria, they used to do it even when some of us were there. Anything you are going to do, your child education is going to school and everything, you have to show your tax clearance certificate. So, but you can do this one, do it properly through digital system so that nobody can dodge. And then government is broadening the tax base. So once everybody has a TIN number, then you have to make sure that taxes are collections from people, small, and it makes a lot of money. So that the 15% that Abuja Declaration said Ghana can achieve it. It's still very low. We are not achieving the Abuja Declaration because of the other areas who are also looking for money. But we are supposed to spend about 15% of our GDP on health. And that's what we are trying to achieve. Yes, health insurance. It's true. Health insurance, the majority of the funding for national health insurance is through also taxes. about 94% of it. But what we have realized, which we are also trying to sort out, is that there is also what they call capping. So we are hoping that all the health insurance levy that we have will be decapped. Once it's decapped, it means health insurance will have enough money, at least, to survive and be sustained. And the issue that a lot of things in the hospitals, even though the patient has health insurance, they do co-payment, which is not in the health insurance law, is also the efficiency and the effectiveness of our procurement systems in our health sector. As I said, most of the things that we have, both consumable, non-drug and drug consumables, are all imported, and it becomes expensive. And because every hospital, every small facility is doing its own procurement system, it makes it also very expensive. So I believe that we should have a broader, or what you call pool procurement, even if you are going to procure from outside. But once we make it in country, it will make it very cheap. And the hospitals, when they are also reimbursed quickly by health insurance, then the co-payment system will go down. Those who are at home, as you rightly say, who are not even accessing health, that is why I say that education is a key. And our community health officers and then the community should also be doing a lot of health education and health promotion within the system. And once we do that, then people will know that they have to access health systems, not to wait till when the case reach a level that they send the patient there for only death certificates. That's not what we want. Universal health coverage is that you have a quality universal health coverage and the people become aware. So these are some of the things that we have put in place to make sure that we have enough taxes, to make sure that the funding problem is sorted out, to make sure that education, which is a key, is also done properly.
Okay, thank you very much. Emmanuel, thank you for your question. We have one in the chat box that says, thank you for the presentation and enlightening us on Ghana's primary healthcare system. What are we doing to bridge the inequality gap with health insurance, since now most medications are bought out of pocket? And another one, what is government doing to ensure that primary healthcare does not run to a halt due to persistent delay and non-payment of health claims, since facilities are not allowed to charge extra on the low premium from the schemes? Dr. Nsiah-Ansari, I think you...
Yeah, thank you very much. Yes, health insurance issues, we are sorting it out. There is, as I speak now, there's a committee in place who are looking at the tariffs. We believe that the tariffs are the issue. If you don't review tariffs regularly and you leave tariffs to the prices are so low of the increase in inflation, then every health facility will charge. That's why a lot of people are buying out of pocket. And as I said, we also want to make sure that most of these things are manufactured in country, so that it's not dollars that you have to change the money to. And then thirdly, also a lot of accountability has to also to come in, especially in procurement of our health facility, health products. But health insurance should also be getting this money regularly, and then pay, if you pay regular every month, then no health facility will wait and go and also credit at a cost. So these are the systems that we are dialoguing of health insurance, and it's a continuous improvement that we are doing there. So we continuously will improve the system.
Okay, thank you very much. There are some hands and questions. We have 2 minutes more, so we'll give the last person a chance to ask the question, then you'll be out of it. 6 twos. Please, in a minute, kindly make your question known.
Good afternoon. Thank you for the opportunity. Yes, when Doc was talking about the challenges in personnel at the primary health sector, he mentioned about accommodation. I want to find out, are there plans in place for business
Since we are
to build these houses or facilities for the nurses and doctors to stay in while they pay something, so for some number of years, then they can hand it over to the facilities. Is this feasible, and is government having that in mind to start anytime soon? Thank you.
Yeah, that's exactly what we are doing. We are negotiating with a lot of private sector people who have shown interest. They've all shown interest. So very soon you see us cutting the sword and breaking the ground for this system to start. To be across the country.
Okay, thank you very much. I'm sure this excites a lot of debates, and conversation on primary healthcare series will continue. We would like to say a very big thank you to Dr. Anthony Nsiah-Sarri for making time. We know it was really, you had to make this sacrifice for us and for all those who have joined us this afternoon. And so we deem this a great privilege to have you online as our maiden speaker for the primary healthcare series of the Africa Higher Education Health Collaborative KNUST initiative. This is led by Professor Ellis Owusu-Darboe, and I'm sure he heard you and would liaise with you behind this. Thank you very much for making time for us and for the useful guidelines you are giving to us, giving us hope that Ghana's health system, we still have a lot to look up to, and then to continue giving our best as primary healthcare workers and people in the health and education sectors alike. Thank you very much to all of you who have made it, all staff, all Africa Higher Education Health Collaborative residents and scholars. Thank you all for joining us for the maiden primary healthcare series. Thank you and have a wonderful evening. Bye to you all.
Bye.